Hi, this is Dr. Matt Rasmussen with Periodontics and Implant Dentistry of Tallahassee. We've been getting a lot of questions recently about emergency dentistry, so we want to take some time over a quick video to kind of go through some of the most common questions that we see when it comes to emergency dentistry. A dental emergency is anything that is causing the patient really any pain or issues that it can be concerning to the patient. So for example, if a patient's in significant pain, I would consider that a dental emergency. Certainly if there's any swelling in the mouth or other bleeding or other problems, that's an emergency that should be addressed by a dental professional. When it comes to your medical care, it's always important to address any medical issues first. So in the event that you think that you've had issues where you're having difficulty breathing or a true medical emergency going on, instead of going to a dental professional, immediately go to the emergency room. If there's not a major issue that's either a cosmetic issue or causing significant pain or swelling, and it can wait until your regular dental visit, then it's best to follow up with your appropriate dental professional. However, there are many times where a true dental emergency exists. Those things can be including pain, swelling, bleeding, or other issues that can even cause cosmetic issues that we want to get addressed very quickly. There's a number of different treatments for different types of tooth pain. It's important that a dental professional evaluate the area to see exactly which treatments are appropriate to get rid of and alleviate any pain that may be occurring. When it comes to dental abscesses or swelling, different treatments are possible. If the tooth can be saved, many times there are different clinical procedures that can help save the tooth. Things like root canals and crowns and along those lines can help. However, there are times where swelling and abscesses are significant enough that the tooth does indeed need to be removed, and we'll look for a replacement option for that tooth. Inflamed gums is a very common issue that people oftentimes will not notice because it's asymptomatic. They don't feel the area. However, if the gums are bleeding, it's showing that there's a disease process present. There are a number of non-surgical, non-invasive treatments that can help with bleeding gums. Tooth sensitivity can come from a number of different places. It can come from a cavity that's hard to be seen. It can just related to exposed root of the tooth, or it can be associated with sensitivity associated with a nerve issue in the tooth. It's important to address the root cause of the problem to address the area of sensitivity, but there are a number of different treatments that can address either the nerve, the outside of the tooth, or any other potential cause of the sensitivity. Fractured, broken, or cracked teeth have a number of different treatments available depending on the level of the crack. Unfortunately, if a tooth is too far gone, the tooth cannot be saved, and therefore we need to look for a replacement. Dental implants is an excellent option to replace such teeth. However, if we have the option to save a tooth, we're always going to look to do that. Many times by strengthening the tooth with other restorative procedures, the tooth can indeed be saved. A dental extraction is a procedure where a tooth is removed because of some type of infection that's present that cannot be solved with the tooth still in place. Depending on the situation occurring, the extraction can either be a simple extraction or a surgical extraction. That's a decision made by the dental professional at the time of the procedure. One of the most common questions that we get is to make sure the patients are comfortable in the chair during such procedures. And then another common question is, what do we do after that tooth is removed to replace it? One of the goals here at Periodontics and Implant Dentistry of Tallahassee is to make sure the patient always has a good experience in the chair. We have several techniques to make sure that it's a painless or as close to pain-free experience as possible, that we have good customer service all the way through the entire process. One common question that we get regarding dental extractions is, can we offer same-day care? Of course, we're going to be working the patient into the schedule and doing as best we can, but the goal is always going to be to address the treatment as quickly as possible, many times treating it the exact day. I hope we've been able to answer some of your questions regarding dental emergency. Please feel free to give us a call at area code 850-692-9200. We look forward to serving you soon.